Hi Aggies, my name is Julia and I'm here with Student Health and Counseling Services today for a new episode of Aggies Talk Health. I'm here with Lynn Delgado, a therapist from Student Health and Counseling Services.
Thank you, Julie. It's nice to meet you.
Nice to meet you too. I was wondering if you could tell us a little bit about what you do here as a therapist.
I'm a licensed clinical social worker. I work at counseling services. I do individual groups. I'm at individuals, and then I also do groups.
We're here today to talk specifically about your group counseling services, and I believe it's called Building Social Confidence. Can you tell me a little bit about that?
Yeah, Building Social Confidence group. It's a very interesting group because I think initially some people think, oh, this is a way to kind of assert myself in the way society thinks we should be. But that's not what this group is about. This group is about the motto we have here is come as you are, and developing skills that you can take care of yourself so you can feel confident in presenting yourself into spaces that maybe you were shy or reserved from.
I mean, as a student, I know that the transition into college is a huge one socially, and you're being really thrown into a completely new situation that a lot of people are unfamiliar with. So I can definitely see the importance of a group like this.
In a college setting, we're all coming from different backgrounds, right? Mm-hmm. And so we've been conditioned by different societal things. We've been conditioned by our parenting, by our environment, maybe some trauma, some experiences. And so we come here and then we are in a new environment that we have to adjust. And it can feel awkward, it can feel wonky, it feels uncertainty, a lot of stuff can maybe come up. And so this group is like an opportunity for people to like unpack some of that. And
why don't you start out by just telling me a little bit about your background?
I've been a therapist, licensed clinical social worker for 26 years. I've been in very many different capacities. I've been a therapist. I've been a CPS social worker. I've done groups. I've worked in hospital settings. I've worked at the jail setting. And currently now I'm at the university in counseling services.
So what has drawn you to student health?
You know, I was in a very career development stage in my life, and I was thinking about that. And I started out as working with child welfare, underserved areas, people with a lot of trauma. The path that I've taken, and I was like, wow, what an honor it is that I've crossed all those different paths. And now I'm at a point where, you know, when we think about from school to prison pipeline, I think, wow, what I've touched on all of those different environments and what an opportunity it is to be at a university where a lot of students have crossed different paths in life, and being able to have the insight, being able to have different students at different times in their lives, and to be able to support them. That was one of the huge things. And the other thing is I live in Davis, and I love the campus. It's a beautiful campus, and I like doing what I'm doing over. I think
UC Davis, we're definitely a school that prides ourselves on our diversity and how we really become an accepting place for students that may not have that super traditional life or have had really hard trials throughout their lifetimes. And so I think that student health and counseling services really comes into play there.
One of the things that I also love about it is there's so many different stories. I love hearing people's stories. And so to have that diversified, people coming from all over the world to come here, from all over the United States, from different communities, sometimes I feel like it's a cheat. It's an honor. It's like, wow, I get paid to hear people's stories.
Sounds like that you love your job.
I really do love my job.
That's awesome. So I would love to hear more about why specifically this group, why Building Social Confidence?
My Building Social Confidence group. When I was working at in the jail, we had to do groups. And what I fell in love with doing the group process was these were people whose backs were against the wall. And they were brave, they were compassionate, and they were honest. They were real. And to be able to hold space for people in that, I felt honored. And so the more I dove into doing the groups there, the more I fell in love with doing groups. And a theme that kind of often came up is when I was initially doing groups is people not fitting in and people not feeling seen, people not being heard. People, how we've been conditioned, social messages we got in social media of how we're not how we don't fit in. So that was my process of falling in love with doing groups and then building social confidence.
Yeah.
Yeah, why not? If I could give a cheat answer to build it, like bypassing, just not even going to the group, the cheat answer will be comfortable. Just be who you are, be brave and compassionate with yourself, and show up and do this dance with the world. And you're going to find the people that will vibe with you and dance, right? So that would be the cheat answer to bypass. But then why do Building Social Confidence group? Mm-hmm. So the Building Social Confidence group is kind of a structured way of how you can unpack stuff. So we do a lot of unpacking, like exploring the self. What are some of these barriers, obstacles, fears, excitements that keep us from? So it creates a safe, brave space for us to unpack some of that stuff. And then from there, we do some skill development and we practice. One of the awesome things about doing a group is that you get the support of other students. In a group setting, you'll see people say, nod their heads like, yeah, like that's real, I get that. And you get validated from that experience. That's what I kind of love about like doing this group process.
Yeah, I feel like this group in particular, it's an especially appropriate group therapy session because, also I think that like having strong social connections is such a protective factor against mental health problems down the road. You know what I mean? You can really make sure people have these communities right when coming to UC Davis before that loneliness starts to really set in and especially during the transition into college. So yeah, so I guess for a student that goes through this group therapy sessions, what would you say the outcome is like? What are students learning? How are they changing? What skills are they developing?
The structure of the group, it's like psychoeducation. Mm-hmm. We do some of that, and then we do a process group. We process some of our stuff, and then we go into skill development. The hope is when students leave is we're not really fixed, but it gives us a way to be brave and to go out into that world. So we'll develop skills such as like that, how to make eye contact, how to walk into a room and feel confident, and how to take care of ourselves when we're in a situation where we're feeling anxious and all that stuff comes up and we feel like we just want to run and hide. That we can develop skills and tips to ground ourselves, take deep breaths in, reflect real quick on our thoughts, maybe sip some water. There's a lot of those kind of skills. So there's a lot of like self-soothing, taking care of yourself skills. And then again, there's also specific skills that people want to know. How do I start a conversation? Some people present to the group as like, I can't even get I struggle with the initial stage of just interacting. So we'll develop some skills there. And then some people are good. It's like, yeah, I'm really good at starting the conversation, but I don't know how to come deeper. And then so we'll do some storytelling and being able to process that, and being able to be brave enough to go deeper into conversations.
No one really teaches you these things, like how to make eye contact, how to maintain conversation. Like your parents aren't sitting you down and saying that. So I think this is a very important group. What would you tell a student that's maybe considering joining this group or interested in learning more, all of that?
Okay. Well, I would tell them to explore. Hopefully, this video inspires you all to come. At the beginning of the quarter, I open up my schedule, and a lot of our schedules are open. You can go to the group, and you could schedule an appointment to be seen. So we do a 15, 20-minute check-in. People can ask questions. There's a website that people could go to and look at what groups that may fit with them. A lot of referrals we get are from campus partners. So they can ask their campus partners about like a group. The other way is like people come in for individual therapy and the therapist may recommend them. And the other thing is I always encourage students just come to counseling services. A lot of times we don't know what we need, right? Yeah. But we just know there's something kind of going on. Mm-hmm. So just come to counseling services. Yeah, I think I need help. And we got wonderful front desk staff that can kind of guide and ask questions. We do have a web page with our staff's name, so you can always look up staffs. And some of us, I believe we have our emails. You can always message, I'm interested in about a group. And can you tell me more about the group video?
I feel like if there's one thing that I know from my time working at Student Health and Counseling Services and just student health in general, everyone is so nice. People just truly care about the work that they do.
Absolutely.
Yeah.
That's one of the other perks is we're kind of like geeks when it comes to like, I want to know more about you. Tell me about how, like, we want to support each other, really care for each other.
Yeah.
Yeah.
I guess to wrap this up, is there anything else you'd like to add about your group?
I want to welcome students to come to the group, to encourage you to be brave, compassionate, and explore yourself. You're young. This is the opportunity for you to be able to develop socially. And you're in a college setting with so many diversified. So I encourage you to kind of come to the group. You can schedule a screening again online through your helping messages. You can always call counseling services. You can ask your individual counselor. You can ask maybe some of the campus partners if they may know of a group or support. Sometimes if you just say, hey, I need support, I need help, a lot of people will point you to counseling services. And once you get to counseling services, we'll help you, support you. We'll ask you the questions you need.
Thank you so much for talking with me today. I feel like I know I learned a lot. Hopefully the students watching this learned a lot as well. Yeah, thank you.
No, thank you for having me. Yes.
I'm Julia. I'm here with Lynn Delgado, a therapist from Student Health and Counseling Services, and we'll see you at the next episode of Aggies Talk Health.